All right, my PowerPoint presentation is over pressure ulcer prevention. This is for my capstone project at Vincent University. So, pressure ulcers cost billions of dollars each year, and around 2.5 million patients are affected yearly. Older adults are more likely to develop pressure ulcers because they have a decreased amount of subcutaneous fat, thinner dermis, and decreased sensations. With the growth of comorbidities and the aging population, pressure ulcers are expected to increase. Pressure ulcers directly cause death in over 60,000 patients each year. There are more than 17,000 lawsuits in the United States involved with pressure ulcers yearly. More than 50% of pressure ulcers develop in an acute care setting. Stage 3 or 4 pressure ulcers can cost anywhere to $5,000 to $50,000 per pressure ulcer. Pressure ulcers developing causes the patient to have a longer length of stay in the hospital. A longer length of stay causes less mobility and higher costs. Initiating evidence-based prevention methods is an effective way to prevent pressure ulcers from developing in acute care setting. So for the literature review, I have 5 different articles that I chose. The first one is PUPB, which is Pressure Ulcer Prevention Bundle. A research study was completed on patients in an intensive care unit to see if the pressure ulcer prevention bundle was effective in 3 different ICU settings at North Memorial Medical Center in Minneapolis, Minnesota. There were 181 patients who had no interventions, and there were 146 patients who had interventions. The methods used for the research were admission and discharge skin assessments, wound, ostomy, and continence rounding sheets, patient characteristics, and 5 evidence-based pressure ulcer prevention methods. The patients who had no pressure ulcers upon admission were given standard care, but those who had pressure ulcers received care by using the PUPB method. Skin assessments and charting indicated whether the patient developed pressure ulcers during the hospital stay and the skin care they received while in the hospital. Assignments, length of stay, and Braden score were factored into the research, and T-tests were used for adherence to guidelines. The PUPB study showed that having nurses round and use pressure ulcer reduction interventions resulted in a decrease in the amount of pressure ulcers in the intensive care units. Elevating heels more frequently showed P less than 0.001. Repositioning more frequently showed a p-value of less than 0.015. Decrease in unit-acquired pressure ulcers showed a p-value of less than 0.001, and the final value was p-value of less than 0.001, which were all statistically significant results for this study. The next study that I chose was Pressure Ulcer Prevention Program, the PUP program. In 2014, a research study was completed on patients at the University of Miami Hospital to help reduce the number of pressure ulcers and to show the current rates of hospital-acquired pressure ulcers. Wound care nurses were hired, beds were updated, protocols for care were updated, and turning schedules were addressed. There were 14 staff members who were involved in overseeing the research of 305 patients used for the research. Of these patients, 2 had hospital-acquired pressure ulcers, 31 had pressure ulcers from home, 51% were females, 80.7% were older than 50, 46.3% were 151 to 200 pounds, 37% were there for 3 days, and 21% were at risk for pressure ulcers. The staff was educated on pressure ulcer prevention methods, and interventions and skin assessments were all charted accordingly and used to develop the research results. For the pressure ulcer prevention program study, there was a decrease in hospital-acquired pressure ulcers. The results showed 2.8% or below in hospital-acquired pressure ulcers, but there was also no p-value for this study. The third research that I chose was also called PUP, but it's pressure ulcer prevention, so just one P at the end. In this research, nurses were interviewed from 4 different Australian hospitals. The nurses were interviewed to see what their perception of interventions involving the PUP program, and each interview was a semi-structured format given by a trained interviewer. There were 45 nurses chosen from each hospital with a total of 18 nurses. The nurses were recorded, transcribed, and analyzed from the interviews, and all of the data was collected from these recordings. All nurses thought pressure ulcer prevention was beneficial for the staff and the patients, and the PUP study could be generalized to a larger population with further studies on larger groups. So then my next research was the skin bundle. And in this research, the goal was to educate staff on pressure ulcer prevention through implementation of the skin bundle, which is surface skin inspection, keep patients moving, incontinence/moisture, and nutrition hydration. In Southwest Essex, there were 22 patients chosen from their homes to be cared for with the skin bundle, and the combined use of dermal pads were also used. The chosen patients were all at risk for developing pressure ulcers. The skin bundle's goal is to prevent pressure ulcers by implementing 5 interventions, which are to ensure the patient is on the right support surface, assess the skin thoroughly, moving by turning the patient appropriately, ensuring proper nutrition, keeping patients dry. Data was collected over 6 months before the skin bundle and after. There were 43 pressure ulcers noted in the first 6 months, and then none of the pressure ulcers had any documentation from this period. Proper education to staff, skin assessments, skin care, and documentation helped to develop the results for the research. For the skin bundle research, they saw a 95.3% reduction in avoidable pressure ulcers and 100% reduction in stage 2 pressure ulcers. There was also a reduction in cost of supplies and care, and this study showed a clinically significant result without a p-value. And then the last research was a communication study. The purpose of this research was to avoid grade 2, 3, and 4 stage pressure ulcers by implementing communication and the skin bundle as well. There were 1,563 nursing staff chosen for this study. Those who cared for patients with pressure ulcers filled out a questionnaire, and the staff was chosen by their experience with patients who were at risk for pressure ulcers. The questionnaire was completed by 73% of the nursing staff, 44% of acute care workers, 88% were females, and 12% were males. Staff also came from 3 different regions in Europe, and 4 focus groups and 6 lengthy interviews were conducted from this group. For the communication study, there was a 45% decline in pressure ulcers that displayed a clinically significant result, and there were no p-values for this study as well. The next thing I'm going to talk about is my PICO, which is P, state of all populations affected by the issue and problem. This is hospitalized and mobile patients. And then I is discuss all possible interventions related to the issue and problem. I chose to do the skin bundle, And C is discuss all possible comparisons related to the issue and problem. And this is using other pressure ulcers bundles versus the skin bundle. And O is discuss all possible outcomes related to the issue and problem. And this is to decrease pressure ulcers. And so then for PICO continued, many hospitalized patients are immobile and may develop pressure ulcers in the hospital. Most pressure ulcers are preventable, and by following an evidence-based intervention of the skin bundle, which is the surface skin inspection, keep patients moving, incontinence and moisture, and nutrition and hydration bundle. Immobile patients have shown a decrease in pressure ulcers from developing. Other pressure ulcer bundles versus the skin bundle compare in decreasing the amount of pressure ulcers, but the skin bundle has shown the least amount of pressure ulcers developing in a hospital setting. The outcome of the use of the skin bundle for 6 months will show at least a 75% decrease amount of pressure ulcers developing in hospitalized immobile patients. So for my theoretical framework, I chose the Newman system model, and this is a nursing theory which takes a holistic view with flexibility. The theory focuses on wellness and prevention. Part of this process is to eliminate stressors from having an ill effect on the body. Newman's theory involves the whole body, and the theory uses 6 steps. Assess the patient, diagnose from collected data, set goals, create the plan, implement the plan, and evaluate the 6 steps involved in the theory. The theory is applicable to the prevention of pressure ulcers because the process involves many steps and flexibility depending on the patient and their risk for pressure ulcers. The interventions for the skin bundle involves surface skin inspection, keep patients moving, incontinence and moisture, and nutrition and hydration. Prevention of pressure ulcers involves the whole body, and Newman's theory also involves the whole body by focusing on wellness and prevention. So for design, setting, and sample, this is going to be a quantitative research project, and this would be conducted over a 6-month period. During this time, there would be a control group and an experimental group. The experimental group would focus on the skin bundle, and the control would not use the skin bundle. It would use other bundles. Data would be collected from charting. Any new or old pressure ulcers would be charted and assessed by the nurses. Wound care nurses would be consulted for any pressure ulcers, and they would assess and document as well. The location of this research would be conducted at 2 different hospitals in southern Indiana. Each hospital would use 2 intensive care units and 2 med-surg units. 1 intensive care unit and 1 med-surg unit from each hospital would be the control group, and then the other intensive care unit and med-surg unit at each hospital would be the experimental group. The hospitals would choose patients based on immobility and risk for pressure ulcers. Hospital staff would choose 30 patients for each unit, with a total of 120 patients for the control group and 120 patients for the experimental group. Selecting patients would involve an initial assessment of the patient. The Braden scale would be used to assess the patient's risk for pressure ulcers. The initial assessment would also determine whether a patient has pressure ulcer prior to admission. After the selection of patients, concise charting would be assessed to determine if the skin bundle prevented pressure ulcers. This would be determined by assessing both hospitals and all groups from a 6-month time frame. No patient identifiers would be used during this research. All patients' rights and privacy would be protected using the HIPAA law. So then for my data collection and data analysis, the instrument used in the future study would be the Braden scale developed by Barbara Braden and Nancy Bergstrom. an evidence-based tool. The brain scale assesses for risk of developing hospital-acquired pressure ulcers. The score can be as high as 23, as low as 6 for each patient. A lower number means a higher risk for developing a pressure ulcer. The brain scale focuses on nutrition, mobility, activity, moisture, sensory perception, and friction/shear. This tool has a high reliability and validity used in multiple studies and settings. The independent t-test would be used to analyze the differences between the two hospitals. Both experimental and both control groups would be compared to each other from the two hospitals by using the brain scale. The brain scale would show each patient which patients are at risk for pressure ulcers, and the control groups and experimental groups would be chosen from the patient at risk for pressure ulcers. The t-test would be concluded by comparing the mean of the control group and the experimental group. So here is an example of the brain scale. In conclusion, hospital-acquired pressure ulcers are more prevalent in older adults and those who are immobile. Pressure ulcer prevention management is a key for this group of patients. The skin bundle is an important intervention method to help reduce pressure ulcers. Other pressure ulcer prevention methods do not always cover all the important interventions which are needed to reduce pressure ulcers. Further research would be needed to confirm that the skin bundle helps prevent pressure ulcers for those who are at risk in an acute care setting. But the research mentioned above could improve patients' quality of life by preventing pressure ulcers. And there's my references. So.